Hello, my name is Ruth Phelps. I am a CHW for Ozarks Community Health Systems in Springfield, Missouri. I'm very excited to be here today. Thank you all for coming. I understand that you're considering opening a position for a CHW in your organization, and I'm just here to talk to you a little bit about what CHW can bring to your team and to your organization and what he or she can do for your patients. First off, we need to remember that not always do our patients remember everything they're told in the hospital or in the emergency room or even by their primary care physician. Community health workers are trusted members of their communities who because of their relationships, are able to effectively provide education and support to improve the health of individuals and their communities as a whole. They can provide many different services, such as make home visits to assess a person's needs for health and social services and provide referrals, reduce preventable ER visits by helping patients use appropriate non-emergency services, help patients gain access to care, encourage patients and help them get preventative care, and reduce barriers to primary care, such as addressing transportation issues. They encourage adherence to treatments, teach concepts of prevention and disease management, provide or facilitate interpreter services, and provide culturally tailored health education. CHW have a strong record of helping to improve people's health, and their role as a bridge between their community and the healthcare system helps connect people with primary care providers so they can get the care they need when they need it. CHWs also help manage chronic conditions, and for example, they help clients control their blood sugar, follow treatment plans, and lower their blood pressure. CHWs can play a valuable role in preventing and effectively managing these conditions, and in return that reduces ER visits. How states can fund community health workers through Medicaid to improve people's health. This is something that maybe later on you can look up and do your own research on. Some studies have shown, like in rural Arkansas, one CHW program for the elderly and adults with physical disabilities reduced state Medicaid costs by $3.5 million, saving $3 for every dollar invested in the program. Potential benefits to a variety of stakeholders: better experiences, better quality of life, lower out-of-pocket costs, fewer missed work days, improved patient communication between providers, better patient outcomes, and met quality targets. Diabetes. What is diabetes exactly? We want to help people. CHWs are helping patients take control of their diabetes through education. And here's some more research that if you want to do later on, feel free to do so. Diabetes. When you have type 1 diabetes, your pancreas can't make insulin, and this hormone helps your body cells convert sugar into energy. And without it, sugar builds up in your blood and can reach dangerous levels. To avoid life-threatening complication, people with type 1 diabetes must take insulin the rest of their lives. Some of the early warning signs are going to be a dry mouth, fruity breath, and having to urinate a lot. Skin problems arise. Many people with type 1 get uncomfortable. Long-term problems, a heart disease and stroke, kidney failure, blindness, or other problems seen. There are many myths about what a diabetic can eat, but in reality, no food is off limits. You just have to have a well-balanced diet and a treatment plan, and the key is to work with your health team to balance that out. There is no cure for diabetes, but you can control it. Diabetes can be prevented. Reduce the risk of developing type 2 diabetes is also associated with obesity. There is treatment for type 2. Treatment typically includes diet control, exercise, and blood sugar testing. So diabetes prevention and management, that's what we're all about. And if we can help these people manage their diabetes, keep it under control, we reduce ER visits. Thank you all so much for hearing me out. I appreciate your time. I hope that you utilize a CHW in your organization.